Hi, everyone. We're going to go ahead and get started. Thank you for joining us. Happy New Year. Good to have everyone back together. And we have a very full meeting today. So we look forward to getting all this information out to you. My name is Hillary Evans, and I work on both the HMIS team and our 2-in-1 Arizona team. And I'm going to go ahead and have everyone introduce themselves on all the panelists that we have today that are going to be covering different topics. So let's go ahead and start with.
Hi, my name is Curtis Hahn. I'm one of the HMIS program specialists, and we go over some vaccination questions later.
Thank you. And how about Michael?
Hello, my name is Michael. I am also a program specialist, HMIS program specialist.
And Thaddeus?
Thaddeus Gassy. I'm one of the program specialists as well.
And Sam?
My name is Sam Debus. I'm the current HMIS business analyst.
And then Stephanie, I think she might, hopefully her audio is working.
Oh, hi, I'm Stephanie Grader, the customer service representative.
And then lastly, I'm going to invite Glory to introduce a new team member.
Thanks, Hillary. So I'm Glory Vercruzen, the manager here for this HMIS team, and glad to welcome a new member to our team. We have a new program specialist. Her name is Dakota Leonard. So I'll invite Dakota just to give us a little bit of a preview about herself.
Hello, I'm Dakota Leonard. I'm a new HMIS program specialist. I was serving as an AmeriCorps Vista at the City of Phoenix Housing Department prior to joining CRN. And I've interned at social service organizations in Phoenix, like the Arizona Anti-Trafficking Network and the City of Phoenix Housing Department. So I'm very interested in housing and homeless issues, and I'm excited to meet all of you.
So we're really glad to have Dakota as a part of our team, new addition.
Thanks, Dakota. Welcome. So the agenda today, I'm just going to quickly go over that. The first portion of the training today will be relevant for both Maricopa and Balance of State, as we'll be talking about the instructions for the Sheltered Point in Time report, and also the introduction of some new universal questions around eviction. The second portion of the training will only be relevant to our users in Maricopa. We will walk through new questions being added to record vaccinations. So if you'd like to stay and see what they're doing, no problem. Or if you have to go at that time, that's fine. So I'm going to turn it over to Glory.
Okay, so just to start us off, I'd like to review our webinar purpose. Our purpose here for the agency admin webinar is to provide consistent guidance to primary points of contact about HMIS workflow changes, policies, data entry, and reporting so that you all are able to instruct your teams, and together we can maintain the integrity of the homelessness data system. We're going to do that in this webinar by communicating any changes to the system or workflows, providing ongoing training, reviewing in-system reporting functionality, reviewing and enforcing HMIS data quality, security, and HMIS privacy plans, and discussing how HMIS data is used in the community. Throughout our webinars, you are going to see some pieces that are going to be relevant for some workflows, some pieces of instruction and training that are only relevant to specific workflows. So Hillary gave us a little bit of a heads up that the first portion of training today is going to be relevant for everyone on the call. And then the second portion, we will have a time that's only dedicated for those who are in Maricopa. So trying to do our due diligence on our side to provide you with the training that's going to be most relevant to you and to give you some detail of exactly what that is.
Okay, webinar reminders, share any relevant information with your with appropriate staff at your agency, ask questions using the Q&A function. Attendance is collected by program. The webinar recording and notes will be sent out on Monday, January 25th. Friday, January 29th is the deadline to complete or to watch the video and do the quiz, the webinar quiz. Oh, Michael will do the announcements.
Hello. Short amount of announcements. We recognize there are known issues with ART. We have contacted WellSky to resolve the issues. WellSky is actively looking into the issues and has said that a ticket has been created and they hope to have a resolution soon. So as soon as we have a resolution, we will update you. Thaddeus, please.
All right. My microphone's a little bit worse today than it has been in the past, so I will try to speak slowly and clearly as I go through this first portion. So there are a couple new UDE questions for both Maricopa and Balance of State. They're going to be located on the Universal Data Elements Assessment, also known as the UDE assessment. These were added due to interest in learning more about the nature of eviction in our region's homelessness. The two new fields are located between the demographics questions and the prior living situation questions. The first is a yes or no. Have you experienced an eviction in the last 12 months? This means the last 12 months before project entry date. You only need to ask this question as of their project entry date. So if they say yes, you would go ahead and answer the second question. Please select the type of eviction you experienced. At this time, we're only interested in 3 types. The first is the kind where COVID-19 hardship led to non-payment of rent. The second is the kind where something else led to non-payment of rent. And lastly, if the eviction was not related to rent repayment, they would select other issue. After answering these fields, you can continue with the rest of the UDE as usual, which would be going on to the fields of prior living situation questions. And if there's no other questions, I'll go ahead and hand it off to the next person, which is going to be Sam.
Oh.
Or was there a question?
I'm going to pause you for one moment. There is a question. The first question is, will we be updating our paper data entry forms? And the answer for this one, yes. We do have the paper data entry forms available, and those should be live on our website very soon.
That is correct.
Okay. And then our next question, do we need to enter this information with our current clients or only new ones?
I actually don't know that, Gloria. Do you happen to know that?
Really, this is a question that has been introduced so that with the idea that you're asking it for your incoming clients. Hillary can provide a little bit more background here, maybe in some detail, but with the eviction moratorium coming up, we're anticipating that there may be a lot of folks who are experiencing eviction, and being able to look at data and really analyze what we can do to coordinate and to help the folks who have experienced eviction is the goal here. So yes, you are only asking this question as of new clients who are coming in, so as of their start date.
So I wanted to give a little bit more information. Maricopa County did their continuum of care did a race equity evaluation with a group called Race Equity Partners, and they came in and looked at all of our kind of processes. And one of the things that we noticed is that we just didn't have really good data around evictions and race and ethnicity. And so we wanted to understand that a little better. Going forward, I think that's something that both Balance of State and Maricopa would like to understand better, is are people entering into the system because of evictions? And one of the quality aspects of this is we can then run reports based on zip code. So based on their last known zip code, we can combine that with were you evicted in the last 12 months and start to see a pattern of where people might be coming from, which could tell us a lot of information about how we allocate funds towards eviction prevention and homeless prevention dollars. So there's a lot of really neat opportunities that we see with this new data ad. And so in terms of the question of, do you need to go back and do this? I would say that Gloria, you said no on that one, right? They don't need it, just is for new folks. Yeah. So I guess just be thinking about, with that context of why this information is really important, is one, it's going to tell us about the impact COVID-19 has had on all of you and your programs. And if we're seeing an influx of people because of evictions, but then it's also going to give us this opportunity to look at the equity aspect of that. So.
All right, Sam, I'm going to hand off to you now.
Okay, so I'll be talking about the upcoming PIT HIC. So this is for the sheltered PIT as well as the HIC. We have the dates are on Maricopa, the 27th of January, and for Balances Date, the 26th of January. We're using a similar process to last year, but really the primary pieces for the PIT and HIC is we want to verify the number of clients served in every project, specifically the ones that house or shelter clients, shelters, transitional housing, safe havens, and then any permanent housing program. We'll want to verify the number of clients served and or housed if you're a permanent housing program. The second piece we also want to verify with that is just that our current bedded inventory information is accurate. So we do submit every year to HUD the current capacity we have in the continuum of care, both Maricopa and Balances Date, to serve clients. We're expecting to see a lot of changes this year, especially with COVID-19. So we know a lot of agencies and providers have onboarded. We know people have decreased decreased number of beds, increased beds, all sorts of stuff. A lot of projects, a lot more voucher projects than we had in the past, especially Maricopa. So verifying really the bed and inventory data that we have is going to be super critical. I also want to make a note that verifying the client counts, all that information will be coming out of HMIS as well. So in years past, we were able to, in some cases, providers would submit the clients served and it would be different from the data in HMIS, and that was passable. Actually, starting in this past year, just the end of 2020, HUD is actually auditing our records year over year. So when we submit the HIC and the PIT later the year towards October, we actually audit the data out of HMIS, and HUD comes and asks us questions about why XYZ doesn't match the submission into HUD and so forth. So it's going to be especially critical for us to have the correct information coming directly out of HMIS. And for that reason, we are going to use processes that leverage actual HMIS data to verify client counts. This is, again, just for the sheltered PIT and the HIC. This is not referencing the unsheltered PIT anyway. So that is handled by MAG, and I know they're doing that a little differently or doing some different counts, but this is just focusing for those projects that actually have physical locations or vouchers. So we'll go ahead and let's take a look at the, next week, at the beginning of the week, we will send out instructions. It'll include a full video instruction, which we included last year. It'll be updated for this year, and the full provider list of providers you'll have to verify information for. I do expect that some of the providers that we send to you may no longer be active, or we might be missing some, so that's a-okay. We just want to get the best data available, and we're going to send you a provider list as complete as we have currently. So Thaddeus, we might go into the next slide. So the first, and maybe basically one of the most critical pieces of the PIT HIC is understanding how many clients are homeless on the night of the PIT. So to that end, we're going to have you run reports in Service Point out of ART specifically to verify client counts. So we did a similar method last year, but we'll be using the 0628 for permanent housing projects and the 0630 for shelters, safe havens, and transitional housing projects. And I'm actually going to go and jump into Service Point and show what that looks like. Both reports are nearly identical. The only difference is the one for permanent housing projects also uses a housing move-in date. So do you mind if I just take the control, Thaddeus? All right, sure. So we have, okay, so here we are in Service Point. I'm in the Arizona site, or excuse me, the Balance Estate site currently, but the same reports will be available on both sites, and they currently are available. So the reports will be under the public folder. They'll be under data quality, and we have the first report is the 628 and is noted for permanent housing projects, and the 630 for shelters, transitional housing, and safe havens. We do recommend that you schedule these reports, and we do recommend running them as PDFs. You, of course, can run them as Excel files as well to get a little more sortable data, but we are asking that providers run this report, and I'll just show how to schedule these reports currently. So all the dates are pre-selected for both continuums, so you can leave the dates as is, and you just have to select the provider that you want to run it on. So we'll go ahead and select, for example, the shelter here, and we'll go and run that report. You'll have to do that for providers who do have 10, 15 projects. You'll have to run this for each project that does submit data for the HIC as well as the unsheltered PIT, because you can only select one provider at a time. So if you do have 3 different shelter projects within HMIS, we will be expecting 3 final reports. As I said, it is designed to be run as a PDF format. It does have all the instructions, and we do want final submissions to really be in that PDF format. The 630 for permanent housing projects, excuse me, for shelters, transitional housing, and safe haven projects is extraordinarily similar. We'll once again have all the dates defaulted. So all you have to really worry about is selecting the correct provider and scheduling that report. Again, if you have multiple providers that fall into the category of this report, you'll have to run multiple reports. Instead of watching them run all day long, well, they actually only take a couple minutes, but we'll review those reports real briefly here. As I said, all this information will also be included in an instruction video, so you can refer to it over time and over again as you are actually working through the 2021 PIT and HIC. So the first one we have is the 628. You'll have a nice link to the walkthrough up top, so you can know exactly what steps you need to take. And this will lay out the exact instructions that you need to do. The most critical pieces of this report, and this will be similar for both of them, is that first you're going to verify the number of clients served. This is just a dummy report here, but what will happen is I'll show your provider, and it'll say 75 clients served. If that's the correct number of clients who were served at the project on the night of the PIT, which will be shown up top, that's fantastic. You can run this report and you can submit that to the HMIS help desk saying this information is accurate and our HMIS data is correct. Now, if it is not correct, and that definitely does happen, especially since we have a few days of leeway to enter data in. So you may not enter data until a few days after client enters shelter, for example. If this is not correct, well, you're going to have to correct the data in HMIS and then rerun the report the next day. ART reports do refresh only every night, so you'll have to wait the next day to run a report. Now, if you are looking at this and say, oh, that client, that's just not correct, the next page just go ahead and shows all the clients that were served in the project on the night of the PIT. That way you can go ahead and audit the information. You can see which clients are counting that shouldn't be, and you can see which clients are missing from the report as well. But this will be the full list of clients who are being considered as housed for the permanent housing projects. And if it's a shelter, transitional housing, or safe haven, it's just going to be any client who's participating. But just do note for permanent housing projects, only clients who have a housing move-in date will be counted in the final tally. But this will allow you to go ahead and audit the data, correct the data in HMIS, and once it's corrected, you'll rerun the report next day, rinse and repeat until the final client counts are correct. From there, we just have to verify some provider information. Again, this is similar to last year, but we've trimmed it down a little bit. And this just to verify the address, the city, the program type. In the vast majority of cases, the program type should be correct, but if it's not, that certainly would be a problem. When you submit the final report, the PDF here, when the client counts are correct, just make a note of any changes that had to be done here. We'll make those updates in the back end, but you just have to note that in your final submission, what changes there have to be, and you don't have to worry about anything else in that regard. So the final page just refers to the federal grant funders or grant types that are available. It's just for informational purposes. Like I said, the one for shelter, safe havens, and transitional housing is nearly identical. Really, the only difference is that this report doesn't care about the housing move-in date since it's not applicable. But otherwise, you'll again verify that the total client served is correct. If it's not, you'll audit your client data, update HMIS, and rerun the report the next day. When the final numbers are correct, you'll submit to the HMIS help desk, and you'll be good to go. So that is the first part of that. So let me jump back into the presentation. Okay. So the second piece is that we want to submit the inventory data to make sure that we have the correct bed and units. As I said earlier, we expect a lot to be different, especially over this sort of crazy year. So it'll be a slightly different process this year. Last year, there was a lot of difficulties and confusion about, beds available and not available. This is especially true with a lot of new projects coming on that don't necessarily have set numbers of beds and units. So we're going to ask for each project that we also complete information about the current inventory. This will be done via a SurveyMonkey survey, and for every provider that you submit a PDF report, you also go ahead and submit one of these surveys as well. You can complete it multiple times in your browser for each provider that you're submitting data for. So let me jump into the actual survey and we'll take a look at that real quick. Hold on. Okay, and just verify, are you all able to see the SurveyMonkey that says inventory questionnaire Maricopa? All right, perfect. So there'll be some logic in here, but the first thing we'll want to do is enter the project information. So the name and ID is always helpful. If you just do the ID or just the name, we'll definitely sort it out. But we'll want to go ahead and provide as much information there as you have. We'll put the person completing the survey. That way we can contact you if there's any questions. And pretty straightforward, we'll select the project type. In some cases, for some projects, this will be very straightforward. So this year, for rapid housing projects, if you do have that, we do request you finish the survey still, but the HMIS team will go ahead and take care of the inventory records for rapid housing projects. HUD does have a pre-specified way for us to kind of record the number of beds and units available, and that should be a lot easier than, especially since there's no set in stone number for those type of projects. Otherwise, we'll have a series of questions to work through. So, for example, if you pick a safe haven project, click next. You'll verify what type of housing you have. You can look at the definitions here. In this case, we'll say this is a site-based project. Okay. And then it's simply verifying the number of clients that are being served in light of the PIT. So first we ask about households with only adults. Next, it'll ask about households with adults and minors or children. And then finally ask about households with only children. So in this project, let's say that there's no only adults beds. So we'll click next. And we'll say this project serves households with adults and children, for example. You can refer this link here. We'll show the current inventory records within HMIS. So this will show your project and the number of units and beds currently recorded as of this week. Now, this is just for reference only. Some of this shows what was on the pick and hit last year, and some of this has been updated as a result of COVID-19. But again, this is just for reference only, so you can get an idea of what has been submitted previously or what's currently in HMIS, in case you don't have a great pulse on what's currently available. We fully expect this information to change. Again, we're basing our final data off of what you submit in this questionnaire, and anything else is just for reference purposes. So we'll go ahead and fill out the information. So if it's a family project, we'll say that they have 4 units and they can serve a total of 4 families for a total of 12 beds, for example. We do ask specifically if any beds are dedicated. You do have to enter something in each field, but we expect that to be a lot of zeros. And if there are no beds that are dedicated for only veterans, for example, or youth, you'll just put the non-dedicated number as being the number of beds. But we have chronically homeless veterans, youth veterans. Just note that these categories do include all family members as well. So if you have a chronically homeless family, it'll include the head of household and all their family members. And the final part is just for emergency shelters only. and you'll verify exactly when beds are available. Year-round, seasonal, so you would think if you're in Flagstaff, you may have extra beds during the winter months, or in Maricopa, extra beds in the summer. But since the pit and hick is in the winter, it's more likely to have seasonal beds for the winter and overflow. But you'll check that all that are applicable. So if you have year-round beds and some extra beds for the winter, you'll just select both those options. We'll say this project doesn't serve any other household type, and you'll be good to go. So let me pull up the presentation again. That will be completely, we'll have all these instructions via video and so forth as well. When we do send out final instructions next Monday, the survey is already made and the reports are available in both Maricopa and Balance of State. So I know that's quite a lot of information, but I'll pause for questions, any questions or concerns, and we can review anything people may wonder about.
I got a quick question. Were you meaning to show something right now? I'm still seeing the results page for the survey. Was there a different thing you meant to be showing?
Results. Oh, I'm trying to go back to the presentation. Do you want to steal the presentation back, Thaddeus?
Sure, I'll take it back to the slideshow.
Yeah.
I think as we're waiting for people to process and put in some questions in the Q&A, for the Survey Monkey, just for clarification, how many times does someone need to fill out a survey? Do they just fill it out once, or do they need to fill it out per project?
So the Survey Monkey should be filled out once per project. So if you have 5 shelter programs, each shelter will have a different bed and unit inventory or a different capacity. So we want to fill it out for each shelter or each permanent housing project, so we have a record of how many beds are available for every project in the system. And again, we'll include a full suite of instructions going step by step, running the reports, as well as going through the Survey Monkey, since I've always found that to be helpful in the past. I do see one question. So for Balance of State, this is the night of the 26th. And for Maricopa, this is the night of the 27th. Well, everything is either fantastically clear because it's so similar, or it's just so muddled up that we'll have dozens of questions after the fact. But either way is okay.
Yeah, it looks like we don't have any other questions coming in. If you do have questions as we're going through some of the other segments of training, go ahead and type those in and to the Q&A, and we'll be able to address those and to answer those. Thaddeus, you want to go on to the next slide? All right, so we have reached the portion of training where we are going to get into a topic, some new additional questions that have been added to HMIS but are going to only be added to the Maricopa system. So if you are here and you are a member from Balance of State, we're not holding a secret meeting. If you would like to stay and watch and listen as we go through some new questions, you're more than welcome. But if not, this is your opportunity to leave early if you would like. Some really quick reminders though before you go. We do have a survey that we send out immediately after the agency admin webinar. It's 4 questions. So if you want to take just a few minutes and fill out that survey, it's really helpful for us. And then of course, if you are watching this video later, or if you're thinking through what we went over and a question comes to mind, please submit a ticket to our help desk and we'd be happy to help you out. With that, I'll pass this along to our next portion about vaccination, vaccination questions.
Perfect. So these new vaccination questions are going to be located at the bottom of the UDE assessment underneath the current COVID-19 sub-assessment. They should be available for all projects. And the goal is to update this field as clients complete their vaccinations. And so you can see here, there's a drop down as well as the date that the first and second vaccination was received. For those date fields, they can only be filled out for a past date or the current date. They can't be filled out in the future because we want the actual date that a vaccination was received, not a future date. So on the next slide, I'll go over through the steps of the process of recording the first vaccination. So this first step to recording this vaccination is updating that COVID-19 vaccination dropdown You'll see that there's 4 different responses. 1 of 2 complete on schedule for second, 1 of 2 complete overdue for second, fully vaccinated and not vaccinated. You're going to answer the one that's most accurate. I think oftentimes we're going to be putting 1 of 2 on schedule and then maybe updating to overdue if clients struggling to get that second vaccination in. And then fully vaccinated is obviously after they receive both vaccinations. Then you're going to fill out the date first vaccination was received field with the date that the vaccination was received, not a future date, but it could be a past date. Finally, you're going to save and exit and then navigate to the client profile tab, which I'll show you on the next slide. So in the client profile tab, we're actually going to be using a little bit of a different process, and we're going to be updating incidents, which might be new to some of you. And we're doing this so that we can notify other providers that a client needs a second vaccination. We'll put a notice on the client's profile. So we're going to go, if you can go to the next slide, I'll show you what all the fields are for that incident and updating it. So this is a look at what editing and adding an incident looks like. The provider should be your EDA provider, whatever you're entering in the client for. The start date is going to be the date the client is due a second vaccination. First time you're going to leave the end date blank. The incident is always going to be public health. There is no incident code, and we're going to make sure that we're selecting ban. Yes, this is what causes there to be the notification on the file so that we know that someone needs a second vaccination. The staff person is whoever's entering this information, and the site's barred from is the organization that administered the first vaccination. Our notes are just something simple like client due for second dose of COVID-19 vaccine. So once you finish editing that incident, you can save, and that's entering the first vaccination. And then on the next slide, I think we're going to go into adding the second vaccination and really completing the process. Again, this is on the UDE assessment. We're going to update the COVID-19 vaccination dropdown as fully vaccinated. And we're going to add the date the second vaccination was received. Again, you can save and exit and navigate to the client profile tab. And so on the next slide, we'll be editing the incidents. You're only going to do this if there was an incident already present. You don't need an add an incident at this time. So to edit it, you're going to click the pencil, and then I'll show you the fields that we fill in on the next slide. So the final steps, we're going to add an end date. This is the actual date the client received their second vaccination, and we're going to switch the ban to no and click save. So that's the basic process behind the vaccinations. These instructions have been updated and are in the process of being put on our website. So they're much more, so you can look them back up and go through it again. This time we're ready to take any questions you might have about vaccination questions.
So we can wait just a few minutes here. I don't see any questions just yet, but I can add just a little bit of detail too, as we're waiting for questions, that when you select an incident and when you fill it out and select ban specifically, it is what will pop up and alert if a client is going to an emergency shelter, as an example. When they pull up a client's profile, it actually provides a pop-up. So this is kind of our workaround within the software to be able to enable the system to provide alerts that a client is due for a second vaccination. So we do have a couple of questions that have come in. The first is, do we create an update for the second vaccine or go back to the original entry? So Curtis, do you want to answer that one, or do you want me to try to field that?
I can answer it. So for the second vaccine, you can create an update and update the entry. And then really you're only going to be filling out this small section on that update if it's simply just for the second vaccination.
We also have another question. Is this going to be on the new paperwork also?
Yes, so the paperwork, just like earlier for Thaddeus, has been updated, and we're trying to get our communications team to upload it to the website, so it'll be available for all of you.
Yeah. Should be up here within the next day or so. And then we have a question from Andy Wambach, who's from Mercy Care. Will Circle the City be entering this for folks, assuming they will be administering vaccines for a large portion of clients in HMIS? That one I don't know of off the top of my head. Circle the City does enter data into HMIS, and so they should be receiving this instruction along with everybody else. So that is going to be the hope, is that there is a coordination effort, but beyond their normal programs, I don't know. That may be something that's going to be worth coordinating with Circle the City. There's another question. Do we have a report around the incident section? Is the UDE demographic report going to be updated to include all new questions? Sam, do we have any reports on incidents that you can think of?
I'm sure we do. I can't think of it offhand, but I will respond to that, or I'll follow up with Thaddeus so we can send a blast out of where that would be.
And then our UDE demographic reports will be updated with all new UDE questions. It is something that we are working towards though. So not something that's going to be immediate, but is something that we are working towards, and that we'll send out an update to let providers know.
For Laura's question, is that something that we wanted to pitch to the attendees, or I don't know that they see that question?
So Laura Skotnicki has a question about whether or not staff at your different agencies have been able to receive vaccinations. So I'm going to put that into the chat box so that if you want to answer there, you can. All right, it looks like those are the only questions that have come in. If there are no other questions, we'll move along.
Okay, well, thank you very much for joining us today. Before you log off, again, we really do appreciate your feedback. You should be expecting sometime in the next 30 minutes to receive an email with a link to a 4-question survey from SurveyMonkey. I hope that everyone will return that survey. If your question was not answered, please submit a ticket to the help desk. Hope you all have a great day.